I'd now like to really hand across to my boss, effectively, who is probably one of the hardest taskmasters I've actually ever encountered in my career, and that is saying something. Tim Briggs is an outstanding orthopaedic surgeon of his generation, and Tim is the national chair and lead for the VCHA, as you already alluded to. He is also the NHS England's National Director for Clinical Improvement and Recovery, and has been the driving force behind continuous improvement of healthcare across our armed forces community. And I think the other thing is Tim is very proud of being honorary colonel of 202 multi-role regiment, Royal Army Medical Services. So, Tim, I'd like to hand over to you now, please, for your strategic overview of the VCHA.
Yeah, so Guy, thank you very much indeed for that. And Kate, I thought what you said was just absolutely brilliant. And what I really love about this is that, like Kate, I never served, but I've always had a real passion for the armed forces. And in my practice as an orthopaedic surgeon at the Royal National Orthopaedic Hospital at Stanmore, thought we could do better for veterans. And really, that's what really drove it. I was on manoeuvres at the weekend. I was up with Guy in Staffordshire on a training in a training area, working with our troops, reservists, but some of the finest people you'd want to know. And it gives me great pride to be their honorary colonel, but actually just cements the passion that I've got, that we've got to make sure we really do things that are right for veterans. Next slide, please. One of the things I heard at the weekend, which I thought was a really great phrase, and I'm going to bring it into the NHS, is do the right thing, not the easy thing. And I understand that is said by the military quite a lot, but that's so true of everywhere you work. And what we must do is bring that into everything we do. So this alliance started back in the day. I think that my first meeting was the CBE report was in 2014, and then it all led from there. But this was our purpose, really, about best practice, improving armed forces veterans care, whilst at the same time raising standards across the NHS. Why is that? Because all veterans are NHS users. So whatever we do and raise the bar for one group, by its very nature, it will improve the care for all. So it's been developed in partnership with the GIRF program, which I lead, which has now become the operational program for the NHS and QI. And also we work through the ROH, which is where I work, as also NHS England. Next one, please. So if I go back to the next slide, please. If I go back to the beginning, and the reason I wrote this was from clinical experience, just like the GIRF program, from what I was seeing in clinical practice. And what I wanted to do was, by raising the bar, make sure everybody knew what the Armed Forces Covenant, and we all abided by it. Wanted to improve care and rehab. Critical is transferring that learning, and we'll come on to that later on, both between the Defence Medical Services and NHS, and also provide a network trusts to look after our veterans with complex needs. Next one, please. So this is the team. At the top, you'll see there, Kate and myself, but actually it's a whole team approach. I was a team player throughout my career. I played quite a lot of rugby, and you're only as good as your team. And this team here is exceptional. And I just want to shout out for Guy, who came to me about, I'm amazed it's 5 years ago, Guy, that's incredible. But he has been the person I've been looking for some time, and I think leads it extremely well. And with all the other individuals, healthcare and also veterans, that really also play their part. So again, many, many thanks to you. We wouldn't be there unless with your help. Next slide, please. So this was the framework, and this is what we do. We now, as the Minister said, we've now got all 205 trusts accredited, which is amazing. And I think Lord Dannett said that as well. This was what we wanted people to do, and what we do. And I think what the Lord Dannett said is absolutely true. This is not a tick box exercise. What we want is to drive on continuous improvement. So we do a 1-year review, and then we do a 3-year reaccreditation, and you can see the 8 areas domains that we're looking at. Next slide. And this is just the sort of comments which I think are so powerful, and we've heard earlier in the talks this morning about lived experience of being in the armed forces, a spouse, etc. But also we're going to hear later a veteran story. But what about this? I just didn't realise how much I'd been carrying that pressure until it was relieved. An NHS staff member are talking about their trust's armed forces network. So again, we know we're making progress. Next slide, please. And again, what we've got is we've now built real support across healthcare and defence. Just look at this. Kate alluded to it. We're now joining it all up. And because Kate's in her position, I in my national position, we now have influence where we can make and embed those real changes. And so for me, this is our time. This is the opportunity to really drive and make sure we embed this into the NHS, DMS, etc. So it is part and parcel of what we do, and it's in our day-to-day business. Next slide, please. I was there with Guy at the Chelsea Hospital back in September when Amanda Pritchard and Major General Phil McNee re-signed the Armed Forces Covenant. And that was a really great thing for me to see the CEO of the NHS reaffirming our commitment to the Armed Forces Covenant and our veterans and serving. So again, we know where the NHS is. We're right behind this as we drive it. Next slide, please. So it started in, as I said, Shavas published in 2014. We then got a group together and we had our first workshop in 2017 now, that's 8 years ago, about agreeing what standards an exemplar trust would demonstrate. And that's where our manifesto came from and our 8 domains. And then we had, in November 2018, our first wave of 25 veteran-aware hospitals, which was fantastic. And look where we are today. And just remember, we've had COVID in the way in 2020. Throughout that, was slowed everything up. So great commitment from the NHS. Thank you very much. But also from my team, led by Guy, to really drive this. And it's been a lot of hard yards, a lot of hard work, but we're in such a good place now. So it's fantastic. Next slide. So there we have it. Veteran aware growth, 100% accredited, which I think is fantastic. But not only that, we're now in independent healthcare providers, including hospices, which have been accredited. So we're widening scope, which again does nothing but good for spreading that really good word about what we've got to do to make sure we look after our veterans. Next slide. So this is the big picture. And you can see that in England now, we've got 100%. If you look at the orange element in the middle of the top bars, you can see we're now doing 1-year reviews and 3-year reviews, and where we are, we've done 78% of 1-year reviews, 30% of 3-year reviews, and the trust where we want to do. If you look at in the devolved nations, we've got some successes in Wales, but at the moment we've got 14 trusts in Scotland, and we know we've got to work with those and in Northern Ireland to really get those across the line. Next ones, please. So this is where we are. We're on a journey for the 1-year reviews on the left and the 3-year accreditations. But as the General Lord Dannatt said, no tick box exercise. We want to see progress. We want to see evidence that what we've done and since we've accredited them, they've really made progress. Next slide, please. And also look at independent providers, hospices. We've got 105 engaged, accredited 44. So again, a lot of sites to do, a lot of work to do. 170 hospices across the NHS footprint. So we've got to still do a lot of hard work to do yet, but we're making real progress. Next slide, please. So as Kate alluded to, and really I'm going to give you an overview because we're going to talk about this later on. The programme doesn't sit still. We develop it. We've got to include the whole community. Want a nationwide approach, so across England, but I want to make sure we've got the devolved nations. Independent valuation to understand how we support organisations. Showing impact. For me, we've got to demonstrate that the VCHA and Veteran Aware absolutely delivers added value. And you look at the top right, data collection, which is going to be really, really important, both for our veterans who attend our trusts, but also rehabilitation. And it's got to be collaboration and co-production. And I think from what you've heard so far, from the minister and also from Kate and myself, this is a joined up approach. So really excited about it. Next one, please. So what are the next steps in the future? Again, data. Data is key. I run the whole GIRF program on data, but then have clinical conversations with trusts, community, primary care, etc. That's what we've got to do. So it allows us and it gives us the tools and the data in which we can have those conversations to support improvement and also hold a lens up to areas that are not being improved and needs to. We clearly got to support our nation. I'm going to talk a little bit about armed forces further faster at the end. CQI standardization metrics, and again the training education program, which I'm really excited about, and it's being run through the VCHA, which I think is great. Next slide. So QI, quality improvement, absolutely. So we don't stand still. And so this is what we're doing in terms of accreditation, how we then improve that, how we get the reaccreditation and add value. And then we've got teams looking at that as well as working across the rehab, the independent healthcare and data project. So a lot going on. And what we want to make sure is, well, what are we missing? What's the gap analysis? But clearly, I want the data about tracking progress and achievement. So we can come next year again and show you what's been achieved in the last 12 months. Because Kate was right. Since we spoke last 12 months ago, face to face, again, we've made massive progress. Next one, please. So embedding identification, the ASK program. So what are we here? That's asking, making sure we ask patients, making sure we ask everybody, have you or immediate family member ever served in the armed forces? This is going to be part of the data collect for the ORP, the Outcome Registry Program, which I chair with Ming Tang in NHS, and it's going to be a massive outpatient. It's going to be a massive program of registries that really provide the data that we need across not just veteran care, but across everything we do in the NHS. And we commenced this in September, which included 36 NHS trusts for the PERS protocol. So fantastic work. Next slide, please. And again, the rehabilitation project led by Linus, making progress. We got veteran-aware therapy champions in 75 trusts. 250 veterans have accessed the support pack and 188 in-service training video views. Next steps, we've got to map the evidence, a scoping review of chronic pain management strategies. That I think that's going to be really critical for something that we're going to have to, which is I think is a really important need. Next one, please. And this is what I'm doing currently. I run a number of programs within the NHS called Further Faster, where we've looked at outpatients. We've looked at a group of 20 trusts in the Midlands and North England, trying to reduce the number of those patients who are economically active on waiting lists, so we get them back to work. And I wanted to do a Further Faster Armed Forces. I'm in discussion with the MOD and the Surgeon General at the moment. There are 3,700 serving armed forces personnel who have yet to have an appointment, having been waiting 18 weeks for an appointment with a condition, whether it's about ears, musculoskeletal, etc. And what I want to do is I want to fast track those, and we're working with the MOD about how to do that. So can we maximize outpatient appointments? How are we going to meet the demand capacity? And how can we enhance elective surgery so that these armed forces personnel are there, ready to go back to the background, back to their regiment or wherever it is, so we can all play our part. So this is absolutely happening at the moment, and those are live discussions, and we hope we'll be able to announce something very shortly. Next slide, please. So this just shows the significant growth and development of where we've come from, and I think it needs no more explanation. It's just a heck of a lot of hard work by dedicated people and the team to really drive change and get that. So well done to the whole VCHA team, and most importantly, to all you people who work in the NHS, all you people who work in care homes and hospices, who really want to be part of this, and now really get and understand what this is all about. So I can't thank you enough. We can suggest what we do, but it's the people on the ground, helped by our teams, that really have to deliver. So fantastic. And we're going to hear some great stuff this afternoon about lived-in experience, etc., and what you've done in the NHS. Next slide, please. So this is the Armed Forces Healthcare Training Education Programme. Next slide. And this is the aim. And again, Kate's mentioned it already earlier today. This is a no-brainer. And I'm really delighted that we'll be leading that and working with NHS England. And I think we're going to be hitting the ground running, I hope, in November. And I've already met the team on a number of occasions. I've seen what they're doing. It just looks fantastic. Next slide. And this is the team that are going to deliver it. It's interesting, a real mix of healthcare professionals and armed forces veterans, which I think makes it a really powerful group because they learn from each other. And when I've met them to go through some of their early videos, making people aware, the stories they tell actually are fantastic. And what's great about them is they're personal. And you heard earlier a day from Sarah, this is personal experiences. And they bring that to these videos, which are really humbling, I have to say, and makes you want to make sure we do this in a really joined up way. Next slide. So in summary, that's where we are. We've come a long way. We're widening scope. We're delivering. You're going to hear about what we're doing later on after coffee. But I'm proud to be chair of this. And if you said to me, Tim, did you think this is where it would go when you started it? The answer would be no. I didn't realise we would get to where we are. But we've now, what I would say, crossed the Rubicon. We've pushed that boulder uphill. It's now really gathering pace. We're working so well with Kate and her team in NHSE, working well across MOD, and my team is absolutely top drawer. And I want to thank them all really from the bottom of my heart for helping us really deliver this vision that I had all those years ago. And I couldn't have done this without them, and importantly, all of you who's here today working in the NHS. It is just fantastic. So let's continuous quality improvement. Let's make it even better. So when we come back next year, there'll be more and more great stories to tell. And we know that we can leave a great legacy and go home at night. We feel that we've done a great job. Next slide. That's it. So thank you very much indeed for that. And it's quite humbling to talk about it. But again, thank you for all your support. It's been fantastic. More to do, but let's get on with it. Guy.
Great. Thanks, boss. And again, I think on behalf of the armed force community, thank you for everything you do. It is really appreciated. And the second person I'd probably share a trench with would be you, Tim, actually. Right, moving on. It's coffee break now.